Hello, I'm Christopher Flanagan, Superintendent of Radnor Township Police. We're here in Radnor Studio 21 to talk about some issues regarding health matters here in the township. This topic comes up every summer, and oftentimes we find that residents are not informed. I'm very pleased to have our guest, Marie Carbonara from the Radnor Township Health Department, who's going to help walk us through a current health matter here in the township. Marie, I'm going to read off a message that some of our residents got, and it brought in some questions, I believe, to your office, the township manager's office, and there's also people who don't know anything about this. So we thought it was an important topic to cover to make sure people are aware of what's going on in the township. Let me just read it. The Delaware County Mosquito Borne Disease Control Program will conduct an ultra-low-volume mosquito adulticide spraying portions of Radnor in Delaware County. Residential and recreational areas within this treatment area will be sprayed to control adult mosquitoes. This is a result of high trap counts and identification of positive mosquito pools in the area. That's quite a statement, but I think you know what we're talking about here, and I think it's important that the residents know what exactly this meant for us when we got this notification.
So that notification came from the county, and that was the county letting Radnor Township, the residents of Radnor Township, know that there was going to be a mosquito spraying via truck to control the adult mosquitoes in the township. So they came to that decision to spray based on a collection of data over the last few months.
Okay, so their decision was based on that data collection, and then they informed the Radnor Township Health Department?
They inform they inform the county, who in turn informs each individual township or borough.
Okay. Now, is this something that we should be concerned about that they needed to spray, or is this something that you would call a proactive measure?
This is a proactive measure, yes.
Okay. And then could you just tell me how they got the statistics or data, as you referred to? How did they decide that Radnor in particular needed to have this done?
Sure. So the county, what they do is they put out traps throughout the township starting early in the mosquito season, which is usually spring through fall. So early in the season, they'll put traps out in areas that that may be wet or hold water, in open areas, parks and things like that. So once the traps are out, then the county actively goes out to each trap over time, brings back the mosquitoes from the traps. They test those mosquitoes for West Nile virus, and then they document that information. When mosquitoes test positive for West Nile virus, they alert the township that the trap was in, which would be Radnor Township. They alert us, and then we usually alert the residents. Over time, they also do, with those testing, they also do mosquito counts. So they gather all that information together, all that data, positive for West Nile's mosquito counts, and then they decide based on that information, whether or not it would be beneficial to spray to bring the mosquito count down.
So obviously, since they sprayed, then they wanted to bring it down this year. But so what you're saying with those traps is we may receive new data on how many mosquitoes we have and other things as well coming up in the near future.
Correct.
Now, when that information comes in, does that go to the Board of Health?
What happens is the information comes in, then goes to the county. The county alerts us, and then that's part of my job in the health department for Radnor Township is I'm a liaison to the Board of Health. So I will provide any information that comes my way to the Board of Health.
Just real quickly, because I think it's important, what is the Board of Health's role here in Radnor Township?
So the Board of Health meets, and what they do is they discuss and they advise the Board of Commissioners of Radnor Township on public health, any and all public health matters.
Okay, so they'll process this information along with many other initiatives that you guys work on, and then they keep us informed, and also they'll ask you as the health officer for the township to put out different information and other things like that.
Correct.
So if a resident had a concern or anything about this particular topic or anything else, they could obviously contact you directly, and then you are the conduit to the Board of Health.
Sure. Mm-hmm.
Now, are citizens welcome to attend the Board of Health meetings?
Yes, they are.
Okay, and when are they?
They occur the third Monday of every month at 5:30, with the exception of July and August.
All right, very good. I heard you mention West Nile virus. Can you just tell us a little bit about that and why we're concerned about West Nile virus?
Sure. West Nile virus is a mosquito-borne illness that can be transmitted to people by mosquito bites. So that's kind of what we're doing here and what the county is doing. They test so they can monitor the mosquitoes and they can monitor the virus and see if it's prevalent in Pennsylvania. So right now there's only one documented case of West Nile virus in a person. So when I say positive here now, it's the mosquitoes that were positive. Now, as far as West Nile virus and the people in our residence, most people who get the virus don't show any symptoms. It's basically 1 in 5 people who actually get the virus show some sort of symptom, and that could be fever, body aches, diarrhea. But like I said, most people don't even know they have it if they get it.
I think it would be safe to say that everybody should take precautions to avoid getting bitten by mosquitoes in the first place, but it doesn't necessarily mean you're going to get West Nile virus if you do get bitten by a mosquito. But what are some of the protective things we could do in general? Because a lot of people are still outside. I know I like to barbecue and everything. It's still beautiful weather out. What are the best ways to avoid mosquito bites?
So yes, the best way to avoid getting the virus is not getting mosquito bites. So what we like to recommend is if you are going to be out during the most active times when mosquitoes are out, which is in the evening or early morning, is just wear long sleeve shirts, long pants, use insect repellent, and the CDC gives a lot of information on insect repellent, and we highly recommend that you use it as it's supposed to be used and as directed by the manufacturer. We also, when you're using insect repellent, we want to remind you to spray your clothes, spray your shoes, and kind of prevent the actual mosquitoes from biting.
So you mentioned the CDC. Could you tell our audience what the CDC means?
Sure. The CDC is the Center for Disease Control.
All right. And then there's other resources besides just what we're talking about on that website for the general public can access, right?
Yes.
Free of charge.
Yes.
All right, so it's very good. Going back to, we went over precautions, you went over West Nile virus, and we appreciate that. Just to make sure the audience is clear, does Radnor Township spray, or is that somebody else spraying? Who's physically spraying the area when they come into town?
Delaware County actually does the spraying.
Okay, so that's an important issue to remember. If I were to have a concern about where they were spraying or whatever was going on, what could I do as a resident to find out if it's legitimate and any other issues? What would you recommend? Well,
there's 2 things you could do. You can contact our office, myself, or someone else in our department at Radnor Township, and then you can also contact the county. The Delaware County Intercommunity Health has their own website and office that you can call, and they have got tons of information to offer residents regarding all types of public health topics. And then there's also a website that the county puts together and is very active, and it's specifically for the West Nile virus and mosquito control.
There's a couple things. Sometimes I've heard stories of like construction sites or certain amounts of water. Are there areas in Radnor or examples you could give a general resident that we could help prevent mosquitoes being in our area?
Sure. So what we recommend is, especially during when there's a lot of rain or just occasionally taking a walk of the perimeter of your yard around your house and looking for any standing water, looking at flower pots that are not used that collect water, recycle bins that collect water, and either walk around periodically and dump those. We also recommend you can put a hole in the bottom of the recycle bin that the water will drain, and anything, and just keep on top of that and get out there regularly to make sure there aren't areas collecting water.
Okay. If I was a resident, and we know there's some construction projects going on in Radnor right now, as in many other communities, what could I do if I see those conditions you just described? How can I get rid of those situations or report them? What would you recommend? So
outside the residence or outside of your home or your neighborhood, as far as commercial buildings and commercial areas or public spaces, they absolutely can contact our office, and we can start an investigation and get somebody to get rid of the water.
Excellent. And your office falls in the township, but you are in the codes department?
We are in the Office of Community Development.
Okay, so you have access to all the people who work with construction, all the vendors, and different property owners, so that's a great one-stop resource if somebody were to call.
Yes.
All right, that's excellent. The Board of Health, when they get this report, will this be posted? In other words, the results that the county had done in their counts?
Typically, they don't go to the Board of Health, but we do. The positives do come into our office, and yes, we are asked by the township to post them on our website.
Okay, so people can find out what happened this year, and they'll know once you guys get updated, you immediately post it. So everybody in the community, in our viewing audience, will know exactly what's happened with this, I guess I'll call the 2018 mosquito activity.
Yes.
All right, excellent. Now, when you report issues to the Board of Health, one of the other things, because it's a neat position you have, you're working with township staff, and you're also working with the Board of Health. What other initiatives does the Board of Health get involved in, and how does your office, your team, work with them?
Well, like I said, we act as a liaison between the Board of Health and Radnor Township. So, and typically what happens with the Board of Health is a resident, it all starts with a phone call. So a resident will call our office or contact one of the members from the Board of Health with a public health matter. And then that begins the discussion. And that's typically what's talked about at the meetings. Sometimes it takes one meeting, sometimes it takes several, and they have various discussions based on these public health matters, and then they make a formal decision.
If our residents wanted to discuss that, obviously, you told us about the Board of Health meetings. Could they set up a meeting with you and your team to discuss anything at any time?
Absolutely.
All right, so that's really good news. If somebody wanted to call the county and find out the specific things that they were spraying or doing, is there a phone number for local residents to call and speak to the county about it?
There is a phone number.
Okay, and we'll provide that, but do you think it would be better to call the county first or you guys, just to give people the best source of information?
Well, that's part of our job, so we would happily look into the information if we don't have it on hand, so they can call our office and we can help them as best we can. And if we can't help them or provide them information that they're looking for specifically, we'll happily give them the information or where they can get the information.
One of the things I wanted our audience to know, are there other people and other sources of information that they can obtain of, I'll call it counties, cities, townships that are dealing with West Nile and mosquito management?
Yes, there's actually a website. It's the Pennsylvania West Nile Virus Control Program, and if you were to pull up that website, you will see it breaks down every county in Pennsylvania, and just from looking at that website, you'll see we're all kind of on the same page. We're all doing the same thing, and we're all fighting the same goal, and that's to lower the mosquito count and prevent our chances of getting West Nile virus.
That's great information, and we'll get that posted so our viewers can go right direct on that website. Thank you. Another question, with this season's rain, which we certainly know has been quite significant, are you expecting any changes, increases because of this unusual weather?
What I do know about that is the rain that we've had in the past had a lot to do with the amount of mosquitoes that we're seeing, and it had a lot to do with the fact that a lot of the townships and counties in Pennsylvania did decide to spray this year.
Excellent. So as we begin to wrap up, Radnor Township Health Department receives information from Delaware County based on their data collected, and they are the people who spray and choose the areas that are sprayed in the township. It's not something Radnor Township does.
Correct.
You guys keep us informed, and we can look for briefings on what mediums do you guys use to let the community know that we're going to get sprayed by Delaware County for mosquitoes.
We're given the alert from Delaware County about their decision to spray, and when they alert us, we put all the information on our social media sites, our website, and also via the township notification system, which you can sign up for by visiting our website, and we will send you out alerts by phone, by text, and by email.
That's great. I think what we'll do is we'll wrap up. Your Health Matters. I'm Christopher Flanagan with the Radnor Township Police Department. We're here in Radnor Studio 21. Have a great day.